That's true. If it is not obligated, then you can do it at your own pace. Under the community social I see.
He is the child of
And also, no. Last day of this office on. She's the HR. I know. You should see it in the office. Only 3 speakers to be unmuted. Only 3. Anirudh, Dr. Gurmeet, and Dr. Rahul. All the others are muted. Okay? This is the agenda.
This is the agenda.
You can ask them to read. The agenda. Yeah, we are waiting for
एजेंडा जो है वो आपके सिस्टम में है ना
you and Judge. You and just Have some coffee or tea? Sure.
Recording in progress.
Those who are online, and just say it's just taking just 5 more minutes before we start. Okay, you just. To all those who are online, just excuse us for 5 more minutes as we are waiting for the chief guest to arrive, and then we would start the evening's ceremony. What is it? These are your notes. Okay, you've given me your notes. సార్ వస్తారా ఆయన వచ్చిన తర్వాత బ్లాక్ उधर नहीं उधर फोन भी लगा वैसे इतना दूर लगा Anand, come here. Why are you sitting in the back? I know we are all perennial backbenchers, but doesn't mean to be here. Please. ऐसे लगा दीवार के साथ और ये चेयर दो पीछे ठीक लगा बस 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 आगे बढ़ Welcome, sir. One more Radha Krishna also will You stay inside, Hari. You're wanted here, so you stay inside. One higher degree. Please.
Not the hospital.
This is my sheet. Huh? Give me your pen. Let's start from here.
Speaking to yourself.
Yep. Vishnu, please. No, sit here. Why is I know we've all been backbenchers. Still, for today's event, you can come to the front. ఆయన ఎప్పుడు కొంచెం కూర్చొని వెనక్కి The back rows don't get highlighted in the Zooms. The front rows do get highlighted. So it's better that it looks as if the front row is occupied. Dr. Jagannath sir, you can come to the front.
I'm here.
To welcome Dr. Guru Reddy.
Recording in progress.
While we are waiting for the chief guest, what we could do is that those who would like to pay floral tributes, excepting the guest sitting in the front, if you want to pay floral tributes to Aashrai, please go ahead so that we save on time. You don't have to hesitate. Please. Start slides are also here. Started slides. He is going to introduce Dr. Lokesh. Please take the slides from here.
I'll just tell out their names, or you want me to just give a brief introduction?
No. Introduction. Oh, here Dr. Bharat is here. Yeah, so he has a set of slides. Welcome, sir. Thank you so much for taking the slides. Wonderful. You wanted this year? You stay that side. Just move that side. I'll move away there. Thank you very much for all the guests, both in person as well as those who have joined online. And we have quite a few of Aashrai's colleagues, his seniors who've joined us from the US, and remembering him both from the family as well as his friends. So welcome to all of you, whether in India or outside India. We have an action-packed program, if I could use that term, for a somber occasion, a solemn occasion, as of what we're going to have today. But it is going to be a fast-paced and an emotional drain for quite a few of us too. But with all of you around, I'm sure that the family will cope with the loss much better than what would have been otherwise possible. Thank you once again, and we now request Harita to take over and take the event forward. Over to you, Harita.
Thank you so much, sir. Good evening, everyone. So a very warm welcome to everyone to this deeply meaningful evening. The felicitation ceremony of the Dr.Aashrai Sai Venkat Gudlavalleti Memory Award, Neurological Sciences 2026 for Research Excellence in Neurology. So my name is Harita Bopalan, and I have a great privilege of being your host tonight along with my colleague Sarah. So now we are here to welcome our distinguished guests. I would request the organizing team to help me out. So we warmly welcome Sri R. Govind Hari Sir, the chairperson of the Prasho Foundation. You can get one. No. It's okay, sir. You. We welcome Dr. Ranga Reddy Sir, Vice President of Prasho Foundation. We warmly welcome the chairperson of this award committee, Dr. Professor V.R. Taraknath Sir. We welcome today's guest of honor, Dr. Hari Radha Krishna Sir. And today's chief guest, Dr. Guru N. Reddy Sir. Now we welcome the distinguished recipient of the second edition of the Dr.Aashrai Memorial Award, Dr. Lokesh Saini, Associate Professor in All India Institute of Medical Sciences, Jodhpur. We welcome all the members of the family, friends, and colleagues of Dr. Aashray and all of the guests who have come here tonight to honor his memory and celebrate the brilliance of the Indian neuroscience. For those joining us virtually, a warm welcome to all of you, and the Prasho Foundation is glad to have you with us. So next we start up with the floral tributes and the lamp lighting. So we start up with request the dignitaries to please come forward and light the lamp and offer their tributes.
So there's a dropper here, just before that, yes.
Changing technology. First you, endowments. Right. Changing the defense.
Just on the sensor. Yeah, okay. On the sensors there.
Both of you together. I'll pick the other dropper from here. Yep. So that we can go add another drop. Thank you. Would you like to offer floral tributes?
Phone speaker has been changed. So all my participants cannot hear the voice. No, it was showing that the default mic has been changed. Okay. And now the online participant cannot hear the voice.
Thank you so much. Dr. Aashray was born on 18th February 1989. He left us on the 12th of March 2024, exactly 2 years ago today. A brilliant neurologist, a compassionate healer, and a researcher ahead of his time. He is deeply missed by all who knew him and by the patients whose lives he's touched in Ohio and beyond. I request everyone to please rise for a 2-minute silence for his honor. Thank you, everyone. Please be seated.
Om Purnamad Purnamidam Purnat Purnamudachyate Purnasya Purnamadaya Purnameva Vatishyate Om Shanti Shanti Shanti.
Thank you so much. Ladies and gentlemen, now I would like to invite Dr. GVS Sir, the President of Prasho Foundation, to start the proceedings.
Presentation. I'll spend about 8 to 10 minutes to actually revisit our memories of Aashray and the evolution of this award, as well as the other prizes or awards that we have actually instituted in his memory to commemorate the various stages of his life, starting from school right up to the higher education institutions. So I'll just try and take you through that journey. So basically, it's about his footprints for posterity, which will remain with us forever. Looking at some of the entire short span of 35 years, as a newborn, a naughty, crying child who would not allow me to sleep mostly at nights, and Vishala was still doing her MD at Sevagram. But luckily, because it was Sevagram, you could get time to manage 2 children as well as the third child that was Vishala's MD. Growing up in childhood, slowly endearing himself to his cousins and growing up into the world, some images of that. Going to his first school, and that is the Bajaj Ashram in Sevagram, where with his cousin and his brother playing in Sevagram. And the difference is more like Laurel and Hardy when you compare the two brothers at that time in life. And both fought with each other as much as they loved each other. But one thing at the bottom that you see, that both of them took to Indian classical music. Aashray played the tabla and the elder brother Anirudh played the sitar. And they would give a lot of performances together during their school and early college days. Anirudh then dropped off from sitar, but Aashray continued his love for the sitar, for the tabla, right till the very end. And he used to perform wherever an opportunity came across, or whenever he was stressed, the tabla was his mode of de-stressing himself. And that is why he enjoyed playing the tabla. And whenever there was any performance of Amjad Ali Khan with the troupe, or anybody whom he would recognize, he'd see to it that we are pulled into that particular event. Growing up into a young adult, he liked adventure, he liked hiking, he liked cycling, he liked trekking, and he'd explore every place where he went to with a lot of enthusiasm. Whether it was the wildlife park or whether it was canoeing, he would be interested in going there. The only time he grew a beard, I can see in the waterfall. I've never seen him with a beard, because whenever he'd come back to India, he'd shave himself clean and then come here. But that was the only picture I have of him with a beard. He enjoyed both his medical school days, and then he was a man transformed after he went to Syracuse, because that small town actually gave him an opportunity to develop bonding with his colleagues and also enjoy what life had to show him in a different country. He enjoyed academics immensely, and therefore, whenever he got an opportunity to present at a conference, he would definitely submit a paper, whether it was the International Congress on Stroke or any other conference. He would try his best to actually be there with a presentation. As far as I remember, he never went to a conference without a presentation. Again, some of the glimpses of his life in Syracuse and beyond, and again, enjoying with that group, the class at Syracuse, a lot of his colleagues and seniors. Dr. Gurbeen, you can see in a number of these, and she would be speaking to us shortly from the US. Next slide. And Jeff, we just go back to the previous slide for a second. There you can see him munch on a sandwich between seeing patients. So he was possessed. He wanted to do everything in the shortest possible time that was available to him. Next slide. Then came the marriage. Again, he started feeling lonely while he was in the US, and he was very close to his mother, and therefore he was looking for somebody to actually fill in that space, that void, when he was in the US. He found a very good partner in Anusha, who's there. She's training to be a pediatric cardiac transplant expert. But they liked each other immensely when they saw each other, and then got married. And the brief period of about 7 years that they were together, they cherished every moment that they had together. Next slide. But then, unfortunately, things ended too soon. I had the fortune to actually be the first person from the family to lift him in my arms when he was born, because it was a cesarean section, the second cesarean. So Vishala was still in the operating room next, but then I had to then take charge at that time. And unfortunately, I had to press the button at the electric crematorium. So this was his office space in Ohio. He had a religious bent of mind. And even in his clinic, he had a great fascination for teachings of the Buddha. It was always there. The Dharmapada would always be there, and an idol of Buddha would be there. And he also liked reading a chapter of the Bhagavad Gita every day, and that was always in his clinic. Next slide. In that short span, because of his academic interest, he published 19 papers. Just a glimpse of some of those papers. Next slide. Like I said, he loved the public. Go ahead.
I dedicate this song to my memories in Syracuse as I move on to the next stage in my career.
Wow.
So we want. So the boy sitting there is Aashray on the tabla, and this, as far as I remember, was the last public performance. So we've tried to build a legacy for him, looking at all the footsteps of his life. So the Mothers International School, which is the Aurobindo Ashram School in Delhi, where he actually grew up from the nursery to his high secondary and secondary education. From 2024, they've instituted an award in his name for the best science student in class 10. So last year, 2024, two people shared that prize. And in 2025, that is last year, Miss Meher Agarwal got the prize. Next slide. At Kilpauk Medical College, which was the place where he studied his medicine, with the Kilpauk alumni, the Kilpauk Medical College alumni, we actually set up an alumni award for the best outgoing student based on the cumulative marks in all the MBBS examinations, so that there would be adequate discrimination, because on the same mark, if you take one subject, there could be more than one person. Therefore, we wanted the cumulative scores, and it was Thiru Suvatish who won the prize last year. And this prize is given by the Kilpauk Medical College Alumni Association and would continue to be given in posterity. Next slide. At sunny upstate, where he did his residency, and where he actually became very close with the program director and his colleagues, they have instituted an award in his name called the Quality Improvement Award and a plaque, which was instituted last year and will be continued again in posterity. At the London School of Hygiene and Tropical Medicine, that was the last program he was enrolled in. So that was the last program he was enrolled in. At the time of his passing away, he was doing a master's in the distance learning mode in epidemiology. So though he was a clinical neurologist, he had tremendous interest in epidemiology and statistics. And therefore, in his name, and posthumously, he was awarded the best student and given a postgraduate diploma with distinction, because he could not complete the master's because of his untimely death. And in his honor, we then instituted the Aashrai Memorial Award for MSc Epidemiology in the distance learning mode for a student with the highest grade point average from a low and middle income country. We didn't want it to be going to a high income country student. We specified that. And incidentally, for this year, the awardee is again a person from India, Dr. Surbhi Gupta Dikshit, who won this award. Next slide. And then finally, the award that we are going to confer on Dr. Lokesh today. So this award for neuroscience research, for high impact research by an Indian based in India, was the criteria that we had in mind, and somebody below the age of 45 years. A young, promising researcher. Last year, we had Dr. Jonas Sundar Kumar from the Indian Institute of Science, who presented his pioneering work on dementia, who got the award. And this year, it is Dr. Lokesh Saini, I'm proud to say, stood out as far as the selection committee went in terms of deserving the award. Just before I end, I'd just like to mention that we've been able to put all these things together. We come from a upper middle class family. But what we have done is, Aashray was, like I said, very close to his mother. He named his mother and me as beneficiaries of his life insurance, along with his spouse. And that amount which came to us, along with some of our personal savings, we put together to institute all these awards. And I think it can be done by anybody. Thank you very much, and back to you, Hari.
Thank you so much, sir. We will now proceed with the felicitation of our distinguished dignitaries, who we have graced this occasion with their presence. I kindly request the organizing assist with the felicitation.
introduction slide of Dr. Gudlavalleti.
Shri R. Govind Hari Sir, Chairperson of Prashar Foundation.
Slide set.
Oh, in person. I'm more known in person than slide.
So please read out.
Chairperson of Prashar Foundation, founder of the Pushpagiri Retina Institute. Advisor in the department, a seasoned development strategist and social entrepreneur with over 45 years of experience. Next, we have Dr. Ranga Reddy Sir, the Vice President of Prashar Foundation.
So please, Dr. Ranga, I request Dr. Govindari Garu to felicitate Dr. Ranga Reddy, the Vice Chairperson of Prashar Foundation, Public Health Policy, Public Health and Health Policy Advocate, with special emphasis on infection prevention and control, an adjunct professor at the Public Health Foundation of India, honorary professor at the University of Hyderabad, founder of SANMED, established the IFCAI, and also established Prashar Foundation. Thank you very much. Can I request Dr. Tarak to please come up and Dr. Ranga Reddy to please felicitate Dr. Tarak, alumni of Government Medical College Guntur, and obviously it's a pride moment for us. Completed DL Neurology from GP Pant Institute, Emeritus Professor of Neurology at NTR University of Health Sciences, Lalita Super Specialty Hospital, and founder of Amravati Institute of Health Sciences. In addition to all that, there is one thing which many of you may have seen on the television and may have heard in the news in the last couple of days about a case where an individual was involved in
चारी नानी वेट करती है मैं को बुलाऊंगा मैं को बुलाऊंगा
So this individual was in the news yesterday and the day before because he is now escaped to the UK, and the extradition treaty is being used by India to bring him back, and the courts in the UK have asked that he cannot be given a death sentence if he has to be sent back to India. This case was solved just because of Dr. Tarak, and you can see here one of the students talking about murder, medicine, and sheer brilliance. Thank you, Dr. Tarak, for solving that. Thank you so much. Professor Hari Radhakrishna Garu, can I just ask you to come up, please? Alumni of Kurnool Medical College, and today I'd request Dr. Ranga Reddy Garu to please felicitate Dr. Hari Radhakrishna Garu. We have a lot of people from Kurnool today, right from our own Dr. Usha to Dr. Jagannath and all of them. So he is an alumni of Kurnool Medical College, and then neurology from NIMS Institute here, formerly head of the Department of Neurology at Osmania, served as the clinical director of Care Hospitals for a long period of 9 years, and currently senior consultant at Medicover Hospitals. Thank you for the new building inauguration today, sir, and several awards, including the Clinical Excellence and Teaching Award by the Time Excellence Group in 2021. Next, can I request our chief guest, Dr. Guru Reddy Garu, to please step forward, and I request Guru Reddy Garu to kindly felicitate him. Founder and chairperson of Continental Hospitals, Hyderabad, a pioneer in gastroenterology, liver disease and endoscopy, with over 40 years of experience. Received multiple lifetime achievement awards, named Legend of the Year by Times of India, a gold medalist from Osmania Medical College, Hyderabad. Later went to the Baylor College of Medicine, Houston, where he did his specialized training and fellowship, and also served the president of the Houston Academy of Medicine. His visionary leadership has enabled continental hospitals to achieve global benchmarks for quality through JCI, NABH, and NABL accreditations, and has enabled Continental Hospital being recognized as India's best hospital in technology adoption. Thank you very much, and we're proud that you're here. Dr. Lokesh Saini, we will not felicitate you right now. We're just introducing you briefly, and then Dr. Tarak will introduce you in more detail. Your felicitation would be after the oration. As alumni of the Stanley Medical College, completed MD Pediatrics from Postgraduate Institute of Medical Education, Chandigarh, PGI, AIMS DM Neurology, Associate Professor at AIMS Jodhpur, and an avid researcher who has contributed significantly to research pathways in pediatric neurology. He is the second recipient of the Dr.Aashrai Gudlavalleti Memorial Award in Neurosciences. If you could just stand up so that everybody can see you, but we finally have you. Thank you so much. The next presentation would be by Professor Deborah Bradshaw. It's a recorded presentation. She had great love, admiration, as well as respect for a younger colleague who was Aashrai. She has been with Syracuse Medical University and a clinical professor for a long time. She's been there with them since 1990. She was a residency program director when Aashrai did his residency, and a member of the American Academy of Neurology and American Association of Electrodiagnostic Medicine. She also has an interest in gender and equity, and she has published extensively in relation to gender and equity. After that, we'll have two of Aashrai's colleagues share their reminiscences about Aashrai. Dr. Gurbeen Kaur, who is again from Sani Upstate. She's a consultant neurointerventionist and vascular surgeon at the Westchester Medical Center in New York. She completed a residency at Sani Upstate Medical University and vascular neurology fellowship from Mount Sinai School of Medicine, and then later endovascular neurology fellowship from Westchester Medical Center. She is a graduate of the Lady Harding Medical College of Delhi and was awarded the prestigious American Academy of Neurology Enhanced Resident Leadership Award and the Graduate Medical Education Award for Professional Excellence. She has authored multiple peer-reviewed articles and has the privilege of having worked with Aashrai during his residency, where she was his chief resident as well. And she, in her own words, considers Aashrai as a younger brother. She'll speak to us shortly. Next. And then we'll have Dr. Rahul Chandak, again from Sani Upstate, who is now a consultant neurologist at St. Elizabeth Healthcare in Kentucky. He is also an assistant professor at the Division of Academic Medical Education at the University of Kentucky North Campus. Completed a fellowship in clinical neurophysiology at Rush University Medical Center and graduated from the Topiwala National Medical College at Mumbai. Rahul and Aashrai were in the same cohort and completed their residency together. And they were such close friends that the last words he mentioned to Anusha before he went in for his web procedure was to trust and contact Rahul if there was any problem during the procedure. So Rahul played a very important role in his life, and he's going to share his thoughts on Rahul, on Aashrai also. Anirudh, who is currently in the US, his elder brother, who normally would have been here, he will also say a few words from the US. So if we could have the recorded lecture from Dr. Deborah, please.
Good evening, everyone. My name is Deborah Bradshaw. I was Aashrai's Neurology Program Director in Syracuse, New York. I'm sorry I couldn't join you live, but I'm honored to send this brief introduction to Aashrai. For special greetings and thanks to Aashrai's widow, Dr. Anusha Kanduri, his parents, Drs. Visala and GVS Murthy, and to his brother, Dr. Anurag Gaurang. Greetings, all of the esteemed colleagues gathered for this important event, and warm congratulations to the winner of the second annual Aashrai Gudlavalleti Memorial Award, Dr. Lokesh Saini. Rather than cite Aashrai's many academic accomplishments, publications, awards, I thought I would like to introduce those of you who didn't know him and remind those of you who did what it was like to work with him and to be his friend. So preparing for this address, I asked some of my colleagues in the Department of Neurology at Upstate to send a few words about how they remember Aashrai. And the first thing I came upon was one of my own letters of recommendation for Aashrai. I think he had the distinction of requesting the largest number of letters of recommendation for me in my academic history. Aashrai loved everything, and he went through several iterations of what subspecialty he was going to take. He ended up landing on neurophysiology and neuroinfectious disease. But this, I'm going to quote from a letter of reference that I wrote for him, I think for his neuroimmunology letter of reference, because it has a little vignette that kind of captures him nicely. Aashrai is shown as one of the brightest in his cohort. When you meet him, you'll quickly see that he's good-natured, curious, and very bright. As a clinician, he leaves no stone unturned, but remains cheerful and efficient while working. I just finished a week on the general neurology service with him, and I was extremely happy with his work. More than many other residents, he took initiative to do outside reading on our active cases. For example, we had a woman with a mass near the pituitary stalk. She had severe, and we were concerned about diabetes insipidus. He reported to me the morning after we had this discussion that serum electrolytes may not tell the whole story and that she may need to undergo a dehydration test. Even more, this patient was on the consult service, not on the actual service he was responsible for, but because the inpatient service was small and he was bored, he joined me and my senior resident on consults. He even wrote consults, orders, and did follow-up notes. And I think that is a first in my career. Our mutual colleague, Dr. Vertino, sent these words to describe Aashrai: bold, measured, deliberate, kind. And Dr. Kapoor sent a kind of extensive text chat that I want to read to you, because it kind of rounds out our sense of who Aashrai was and what it was like to be with him. He says, Aashrai was extremely respectful, knowledgeable, and caring toward his patients and their families. A native of Andhra Pradesh, he grew up on the campus of India's most prestigious medical institution, the All India Institute of Medical Sciences, AIIMS, New Delhi, where his father was a professor. He was multilingual and spoke his native language, Telugu, as well as Hindi and English. He enjoyed hiking and reading, but was also happy to participate in activities with his friends. And continuing here in Dr. Kapoor's voice, I vividly remember attending an epilepsy course at GW University when he was a clinical neurophysiology fellow there. I called him to discuss the course, and he immediately invited me to stay with him. I stayed at his place, and we attended the lectures together at George Washington University. After the course at GW, we went to watch the Hindi movie Super 30, which is about the life of a teacher and his passion for preparing underprivileged students for the India Institute of Technology, IIT, entrance examination. While watching the movie in the theater, there was a scene that portrayed medical professionals, especially doctors, in a negative light by suggesting that some doctors are corrupt. Aashrai was so offended by this portrayal that he got up and decided to leave the movie in the middle. He strongly believed that the medical profession should not be portrayed in a tarnished or derogatory way. In summary, I can only say that the world, and especially his family, lost a bright light when Aashrai left us. It's still hard to believe that he's gone. And I think it's through this award ceremony, this annual award, and we have a quality award here with this dedicated to Aashrai. This is how we keep him with us in whatever way we can. And these small memories of him, these moments captured in amber in our hearts and minds, keep him with us always in a small way. Thank you, everyone. And again, it's been an honor to offer this introduction to Aashrai. And again, congratulations, Dr. Saini.
Thank you, Dr. Bradshaw, for those deeply moving words. So now we come to the most personal part of the evening, the voices of those who knew Dr. Aashrai the best. Those who worked alongside him, learned from him, and were inspired by him every day. Memories carry people forward, and tonight, two of Dr. Aashrai's dear colleagues, Dr. Gurmeen Kaur and Dr. Rahul Chandak, will share their reminiscences.
Thank you, everyone, especially Aashrai's parents, for giving us an opportunity to remember Aashrai, celebrate Aashrai, and Aashrai will always, the grace with which he led his life will always stay with us. In sort of, after getting the email from Dr. Murthy, I was, sort of going over my thoughts and memories, and I realized that other than immediate family, I might be one of the few people who's had the privilege of interacting very closely with both brothers. I actually went to school all the way through high school with Anirudh, and we used to call him Anirudh, but Aashrai called him Gaurang. I knew he had a little brother. I did not know that life would bring Aashrai so close to me. I know when Aashrai mashed in Syracuse, he sent me a message, I believe, on Facebook, introducing himself, saying he's Gaurang's brother. And he was very, very excited to come to Syracuse and join residency. I was a couple of years senior to him. And in even one of the introductory meetings, he basically was like, yeah, I know you went to school with Anirudh, but I essentially went to a better school than the two of you. And that was Aashrai. He had this really warm, competitive streak. And, the more I got to know him over the years, the closer we were. And at this point, it feels like he's my younger brother. He and my husband used to be in Syracuse, celebrate birthdays together. February 18th was Aashrai's and 17th is his. He changed his numbers midway through basically when he moved for fellowship. And in one of the last texts on the old number before he started fellowship, one of my exchanges with him is "Happy birthday, Aashrai," and a picture of my newborn being like, "Look what we brought home on your birthday." And that is something that will always stay with me. Very, very rooted, very strong value system. He was extremely proud of both his parents. Multiple times he, sort of told the story of resilience of his mom and how much strength he had always like acquired from that, and how that motivated him to go into neurology and become a great neurologist. In every event in Syracuse that had any Indian touch to it, Aashrai was there first and foremost on his tabla, participating, whether it was Department of Neurology, Department of Medicine. He loved to hike. You saw a lot of the pictures, but I have many more of hiking in the Catskills with him, biking along Green Lakes. We used to a lot of biking trips with just me and Aashrai and another friend of ours, Sonal, and we used to basically put all 3 bikes on the back of my car. The actual carrier Aashrai inherited from me when I left Syracuse, along with a lot of furniture. Memories like this always gonna stay with us. I remember him buying his first car and his first long drive, which was to the AAN in Boston. And I was such a proud elder sister, sitting next to him on that drive, seeing, him sort of, overcome that milestone of his first long 4.5-hour drive. I remember him meeting Anusha, sending me a text when he'd gone to India. And I remember all the beautiful pictures from the wedding, meeting Anusha, and then seeing him win the New York State competition, the neurology competition, seeing him graduate and sort of, enter into an attending role with plans to go to NIH for his neuroinfectious diseases fellowship. Something that was neuroinfections and neuroepidemiology was something that was very close to him. And that interest came from his father and, everything that he had sort of experienced growing up. It's a huge loss for everybody. Every time spent with him will always stay with us in a very, very, very precious way. And at some point, words fail you when you're, remembering somebody so close to you who had so much more to bring to the world. With that, I would like to congratulate Dr. Saini on winning this award. We are very proud that you're going to use the award to advance the field of neurology as Aashrai would have wanted. Thank you.
Thank you so much, Dr. Gurmeet. Dr. Rahul Chandak.
A very good evening to everyone, and a great thank you to Aashrai's family to invite me to speak here today. And again, a big congratulations to Dr. Saini on winning this award. I want to begin by admitting something honestly, that I'm terrified of speaking here. Not only because of my fear of public speaking, but also because I know I will never be able to do justice to Aashrai's memory in just a few minutes. It's people like him that leave such a deep mark on all the lives around him, that words, like Gurmeet said, are just inadequate to capture what he meant to us. I met Aashrai when we started neurology residency together in 2015. As we all know here, residency is one of the most intense parts of our professional careers. Most of us were away from family, trying to find a footing in a new profession, in a new geography. This is when Aashrai and I became good friends very quickly. And over the next 4 years, he became one of the most important people in my life. Any of us who know him well know that how deeply intellectual, Aashrai was. He was very curious about the world. He had a remarkable ability to think through problems with a lot of clarity, with a lot of precision. This reflected in his clinical work, in his research work, where he was truly, truly gifted. Many times during residency, when I was struggling to come up with before I would present the case to my attendings, I would often call Aashrai first so as to not look like a complete fool. And he would almost always get me the right answers. This continued even after training, what I would call him frequently with clinical dilemmas, to a point where even after his passing, I instinctively opened his contact to reach him, knowing that I won't be able to do that anymore. It's just heartbreaking. That definitely does sort of reflect on his character, on what kind of a colleague and what kind of a friend he was. Deeply, deeply wise, and with great empathy, he would approach most of the problems I ever brought to him, and trust me, there were plenty. Our friendship wasn't, however, limited just, to clinical cases and hospital work. The memories that stay most with me are the ones outside of it. Another colleague pointed out his love for movies. He would drag me to these movies that would make you think long after they ended. Unfortunately, I wasn't the best partner for these very intellectual movies. He would drag me to these with great enthusiasm, and I would pass out in most of them halfway. That became a running joke, throughout our lives. We also played a lot of soccer together. And if you ever saw Aashrai on the field, you immediately understood something about his character. Most of us and my colleagues would be there just to have a good time, to sort of de-stress after, grueling week at work. But Aashrai was different. He would play each game with so much grit. When most of us looked at it as a friendly competition, Aashrai would always his body, with. I would tease him that sliding across the wet grass was easier for him because he was a little closer to the ground than most of us. But those who knew him best knew that it wasn't about his height. It was about his determination, his ferocity. Something he approached everything that he did with basically no half measures, went completely out, whether it was tabla, whether it was soccer, whether it was neurology, whether it was life in general. The other favorite memories of mine were frankly very simple ones. We would go on long drives where he actually has been pulled over for speeding with me. And we tried to talk ourselves out of a speeding ticket that failed. We would just hang out after work at each other's homes or go on long hikes together. And we would just talk about medicine, future, our families, about life. And those conversations are probably something that I will cherish for the rest of my life. They were thoughtful, they were honest, always with a dry sense of humor that he almost always found funnier than most others around him. Those conversations will just always reflect the kind of person he was: curious, empathic, reflective, and original. He was very spiritual, when I learned about his diagnosis, we would often talk about how he was approaching this. And he would say something that stays with me even to this day when I try to remember to not take myself very seriously. And his answer to this problem was to just consider himself as such a minute part of this universe that we exist in. And that helped him cope with this diagnosis. And he was probably braver than I was going into the procedure. And we had plans of meeting after. Unfortunately, they just never came to fruition. He was, as you all know, like an exceptional researcher. I used to often tell him that the only reason I was friends with him was to one day maybe get a brief mention in his Nobel acceptance speech. Unfortunately, that speech didn't come, but what he leaves behind is very, very meaningful. The impact on the people he had around him, his patients, his colleagues, his friends. That is why I think this research scholarship is such a beautiful and fitting tribute to his memory. And I would like to extend my congratulations to Dr. Saini on winning this. I just feel so fortunate to have known Aashrai through some of our toughest times in life. I just cannot ever forget the call I'd gotten from Anusha when there were mishappenings in the procedure. And I remember seeing him in the ICU. It's one of the hardest memories I'll ever have. Just from wherever you're listening, Aashrai, just wanted to say I miss you terribly, my friend. Thank you all.
Thank you so much, Dr. Mohan. I would like to invite Dr. Aashrai to share a few words.
Good evening, everyone. Thank you, Gurmeen and Rahul, for sharing your memories with Aashrai. At the beginning, I want to congratulate Dr. Saini for his work and for being chosen for this award, the entire Aashrai family for working to make this event successful. Mine would be very short, but I find it really strange to be here, especially because Aashrai kept inviting me to come to the US. The first time I did end up coming here was on a very unfortunate occasion. Yeah, and now that I am here, it gets tough many days. But like others, I have very fond memories of him. We used to fight a lot, argue a lot. I think all friends know his love for argument. We loved a lot, and at times we hated each other a lot. But whatever we did, all of that was with a lot of passion. And I think passion is what drove him. Passion is what drove him to be a student. From it to do multiple times from the first page to the last page to ensure that he didn't miss anything. How he quickly generated interest in Harry Potter and just thought it was a waste of time by the fifth book because he could already see what was happening. The way he taught himself to bowl like a leg spinner because he thought that was the cool thing back then, just by watching videos of Anil Kumble or Paul Adams on TV. learning to play the tabla with all its intricacies, and finally achieving his dream of studying neurology, being a resident in the US. He was younger to me, sure, but much more mature. In our difficult times, I think he was the North Star. Yeah. Though I think we all miss him terribly, but it is great joy that we are somehow trying to keep his legacy alive and moving through this award. And I hope we are able to motivate more young neuro researchers to continue on their chosen path with the blessings of Aashray. Thank you so much. Back to.
Thank you so much, Anirudh sir. So moving on, it's my privilege now to invite Dr. Taraknath today to introduce Dr. Lokesh Saini. Over to you, sir.
I thank Dr. Murthy Vishala and all the Prasha Foundation for having organized this function in memory of Aashray. And good evening, ladies and gentlemen. Now, research in India, at least when we were students in 70 and early 80s, always took a backseat. Because you know what the infrastructure, most of the treatment was in government hospitals. There were not many private hospitals. And you know what infrastructure they had? The only OP ticket that was 2.5 inch by 5 inches paper on which you have to write a diagnosis. So documentation of findings, filing and keeping them was next to impossible in those days. So it's no wonder that on diseases where India tops in infectious diseases, tuberculosis, cysticercosis, we had to depend on literature from the West, who would have hardly seen 1/3 or 1/10 of any doctor who would have seen those cases in India because of lack of documentation. So I'm glad that this gap is being filled up. Subsequently, I remember when we had to look for a case report, we had to go to the library, tell that chap to give us certain journal. It would be there somewhere, which filed up, bundled up with a lot of. Thanks to information technology, now documentation is easier, your access to information is easier, and therefore, and the shift has been from the government setup, at least majority, to private setup where they can afford, and the affluence in general public has improved, so documentation has improved. So we are now having our own data. We should generate our own data. We can't rely on Western data for treatment. So our own data is being generated, and I'm glad in this direction Murthy and his family have donated generously towards advancing the passion and legacy of Aashray. And it gives me great pleasure to introduce this year's awardee, Lokesh Saini. He graduated from Stanley Medical College in 2006, and he did his MD Pediatrics from PGI Chandigarh in 2012, and DM Pediatric Neurology from All India Institute of Medical Sciences, New Delhi in 2016. He worked as an assistant professor of pediatric neurology from 2017 to 20 in PGI, and later as associate professor. Later, he joined AIIMS Jodhpur as an assistant dean and research in charge of fellowship program. Currently, he is an associated professor of pediatric neurology. After that, now he's there in Jodhpur as an associate professor of pediatric neurology. He was awarded several travel fellowships to attend various international conferences during his study periods and subsequently too. He has mentored several students who went on to bag very good accolades and then several awards in various conferences. He was awarded the 20 San Servolo Fellowship in 2024 and won Fodder-Viren grant in 2024 by European Society of Microbiology and Infectious Diseases for his work on neuroinfections, for which India is the hub. And he won international scholarship by an Academy of Neuro Autism by Indian Academy organ low biomechatronic and efficacy of virtual reality in improving visual perception and eye coordination. For reduction
Aashrai. He graduated from Chennai. So today I have chosen for this oration this topic that is pediatric movement disorders. Why this? Is also movement disorder is something which even a non-neurologist will understand. Something which it runs through videos, it runs through emotions, and that is what I wanted to show through my presentation. And I'm not a core researcher, I will say it upfront. I publish whatever I see, so that is a lot of clinical neurology. I will do that. So objectives of my presentation today is introduction, then classification. I will just briefly classify for everyone in the house, common movement disorder in clinical practice, and then case scenarios. So coming to the introduction part, what are the movement disorders? So I will be dealing only about pediatric movement disorder, but in particular, so impaired voluntary movements or excessive involuntary movements. So it can be low movements as well as high movements. Not always it is, can be perceived upfront. So sometimes it can be hypomotor. They will result in abnormal tone, posture, balance, or fine motor control. Involuntary movements, very common in children, and they mimic many serious abnormalities also. Sometimes they mimic seizures, for which they receive so many anti-seizure medications sometimes, but actually these are movement disorder, nothing seizures. There are no specific diagnostic tests to differentiate these movement disorders. This is only clinical acumen. Nowadays, we do get a lot of help from the mobile phones. So that is very helpful to us in our practice right now, because we can see what is happening at home, what was happening at home. So we can have a judgment based on these movement disorder, based on our experiences. So coming to brief classification, just hyperkinetic and hypokinetic. And among hypokinetic, akinesias, apraxias, catalepsy, drop attacks, rigidity, freezing, more of adult neurological problems, not we see very often in pediatric age group. And in hyperkinetic disorders, ataxia, atitosis, bellisms, chorea, dystonia, myoclonus, stereotypies, tics. These are very common in pediatric age group. Coming to the different classification, so rhythmic and non-rhythmic. So there are two entities which are rhythmic, tremors and stereotypies. Non-rhythmic, then they can be slow, which case atitosis, sustained, which is persistent, abnormal tone, dystonias. Then rapid, which is one is non-suppressible, balismus, amibalismus, chorea, myoclonus, and there sometimes they are suppressible. And if you ask them child to do, they will perform in front of you. So just for brief introduction, these are all patients consented videos at our center. So in the first slide, if you can see, these are the different types of stereotypies, repetitive movements, which is happening. Different etiologies are there. In this particular child is visually impaired. This child is autistic. This child is having Rett syndrome. You can see midline stereotypies. This is very characteristic of Rett syndrome. They will have all the time repetitive hand movements, especially in the midline. Next slide, which is very important. So many of my students are from Hyderabad. So the voice you are hearing is a girl from Hyderabad only. She is about to finish her training.
Not the patients.
Not the patients. So all these videos, if you see in this particular slide, they are like dancing, flowing, continuous movements. And these are characterized as choreas. Different type of choreas you can see. Proximal predominant, abnormal, flowing dancing movements. This particular child can reproduce movements on will, can stop also. This is tics. Looks very abnormal, but these are tics. These are tremors. Different type of tremors. This is intentional one on the right side, not on the left. It is not present, but on the right it is there. And these are very evident abnormal. And this particular slide shows different type of myoclonus, positive, negative. Myoclonus is nothing but shock-like jerky movements. You can see in the first, that's girl. Sudden movements which can happen. Different etiologies are there. This particular child also has ocular movements. If someone can perceive, many ophthalmologists are here in the house. Ocular movements are also ongoing. This child is having oxalosis myoclonus ataxia syndrome, which is treatable entity, usually associated with a neuroblastoma in 50% of the cases. So I will be presenting some cases. Just this was the introduction, so that everybody will understand what predominant movement disorder we see usually. So my presentation will have a lot of interesting cases, diagnostic dilemmas, detailed clinical evaluation, then treatment challenges, and most of them are reflected to standard therapy, but all were treatable and we could treat them. First case, 7-year-old boy from Barmer, progressive ascending weakness and decline in speech output for 20 days. This was the child who presented to emergency, hardly able to move. Sensorium was normal. irritable, generalized hypotonia in lower limbs, weakness of all four limbs. DTRs are elicitable but arguable. Like I was arguing that it was not there, but resident was telling it was there. So we have an argument over there. So it was just sluggish DTRs, or you can say absent. So we could keep a possibility of Guillain-Barré syndrome, 20 days history, ascending weakness, and child hardly able to move, non-encephalopathic demyelination, anterior onset myelitis, all these causes of flaccid paralysis. So child was completely flaccid. So we kept these possibilities. Sensorium was normal. So non-encephalopathic demyelination is another possibility. So workup wise, we did CSF, neuroimaging was normal, brain and spine. Usually in Guillain-Barré syndrome, we get a spine finding, this caudine equine enhancement. So we were also sure that it is definitely not there. GBS is not the possibility. Demyelination is ruled out. So our all three possibilities have some neuroimaging correlate, and they were ruled out by normal neuroimaging. NCS was also normal in this child, nerve condition studies. So we were very sure we were missing something. So this thing I have only read, even wrote a chapter that is the entity which is paralytic chorea, but I have never seen it before this case. This was a case of paralytic chorea. We examined this child. He had a murmur, systolic murmur. Even cardiologists are there in the house, and they will be interested in that, this type of presentation. So this child has fulfilled that Jones criteria, rheumatic heart disease, and this is a presentation, severe presentation of Syndrome chorea, which is chorea paralytica. Surprisingly, I have written a chapter on this before this entity, and I have mentioned this. There is an entity, but I have never seen before seeing this case. So child, I have been treated with immunotherapy. Child responded well, and what we could see when he was recovering, we could see all the signs of chorea coming. So there is a case of reverse chorea. So he was not at the admission, but having chorea signs later. So he has milkmaid grip, darting tongue signs. What are the classical signs of syndrome chorea? We started on prophylaxis. This is a home video where child is walking again, but you can see some part of chorea is still evident is there. So this is a chorea in reverse. So very interesting presentation, but child is completely fine now on benzathine penicillin prophylaxis. So still it is happening, this disease, which we used to see not in the metros, but in our like government hospital, we see almost every month one case of syndrome chorea. So what are the learnings from this case? So hyperkinetic movement disorders may mimic acute flaccid paralysis. Sometimes it is very rare, but we have seen. A detailed systemic examination is essential in all cases. Adult neurology and pediatric neurology. Adult neurology people do this thing in general. They don't miss cardiac murmur at presentation. But pediatric neurology, what we see, there is observation science more of. So we go with the whatever, okay, this is flaccid paralysis, these differentials are there. So we used to miss this entity at presentation, but maybe we would have missed because treatment is same in for non-encephalopathic demyelination, GBS, IVIG, if you give, they will improve. Immunomodulatory therapy should be considered early in disease course in such severe cases. So that was a learning which we should do a proper systemic examination even in a hypokinetic movement disorder. Coming to case 2, 14-year-old boy from Nagaur, fever, vomiting. Nagaur is a town in Rajasthan, nearby district from Jodhpur. Fever, vomiting and headache 25 days back, emotional lability for 14 days, progressive stiffness of whole body for 10 days. When child came, child was completely Parkinsonian. So hypomotor, not able to walk, having waxy flexibility, mask faces, rigidity, catalepsy, all signs of Parkinsonian presentation was there, severe presentation. So we kept differentials as post-viral encephalitis sequelae, but because this illness started with fever, if you can see, fever, vomiting, headache, 25 days back. So we thought maybe in sequelae, probably the MRI will show or basal ganglia involvement, brain stem involvement, and so we kept these possibilities. Then we are nowadays seeing lot of cases of autoimmune encephalitis, and it is in fashion, especially in pediatric as group. We thought it is a presentation because Parkinsonian presentation is described for NMDR encephalitis. Not always it is hyperkinetic. Sometimes Parkinsonian presentations are described. And then neuro-Wilson disease, always we see whenever there is acute history, 20-25 days of rigidity, vessel Young's signs, if you find in particular. And CNS lupus, this is lower down. Workup wise, this child has this biofire which we do for CSF is negative, KF ring was absent, ANA, retro, MOG antibodies, which is again another form of autoimmune encephalitis, is negative. CSF NMDR antibodies is strongly positive in this child. But when we did MRI, we also could see there is a post-viral sequelae insult also. Only in substantia nigra we could get this finding, on which is also not symmetric. This is more on the left side. You can see this hyperintensity here, showing diffusion restrictions also. So this was there. So we, in general, in our hospital, we are monitoring these children for autoimmune encephalitis using this score, clinical assessment scale in autoimmune encephalitis. So this scale we use for till what extent we should treat these children. So for that purpose, so maximum score is 27, minimum is 0. So we try to improve these children to the scale of 0, and we try to escalate the immunotherapy. So methylprednisolone given to this child, rituximab was given to this child. Child showed improvement, but still he was not back to his normal. We also concluded that there is a substantia nigra injury, dopamine is needed. We added dopamine here. So not only immunotherapy, we did something which we have learned over years, that we also treat something which is evident on the neuroimaging. We added dopamine and the child have good brisk walking and good facial emotions also later on, and child has improved completely in the follow-up. Also required 1 dose of immunotherapy later. So this is was the latest video which we asked from the home. So learnings from this case was recognizing the atypical phenotype of a relatively common disease. Why I will say relatively common here? Because nowadays autoimmune encephalitis is in fashion. My neurologist colleagues will and seniors will believe that autoimmune encephalitis is one of the important differentials here. Symptomatic treatment with dopamine and its agonist in case of substantia nigra involvement is essential if the child is not showing the desired improvement. Response should be guided using standardized scores to decide further immunotherapy. We should not give blinded immunotherapy. We should have some substantial subjective scores for guiding us that this child is not improving to the maximum. Coming to case 3, 4-year girl from Jodhpur, fever for 3 days followed by involuntary body movements for 15 days, altered sensorium for 5 days, history of unknown onset seizures, 1 episode. So this child, you can see that there is involuntary body movements, altered sensorium. So there is an encephalitic-like presentation. The child was completely encephalopathic, having movement disorders also. And nowadays we see this type of presentation in this autoimmune encephalitis again, NMDR encephalitis again. Especially when MRI is normal, and if we see all this encephalitis is also there, then movement disorder is also there. There is no correlate in imaging. This NMDR differential comes strongly. So you can see lot of movement disorders, lip thrusting in this child, completely encephalopathic. The minimally conscious, bedridden, high amplitude fringing movements of all 4 limbs consisted in coliform movements with teresmus. The differentials herpes, because acute history was there, and herpes can trigger NMDR encephalitis, autoimmune encephalitis again. Then metabolic disorders, which has been first time presented now to us, decompensated by some febrile illness. So for all these 3, and neuroimaging will show something except NMDR encephalitis. CSF was normal. Infections we always keep upfront whenever we keep such possibilities. So we do CSF. CSF was normal. Viral panel was negative. Metabolic workup was negative. CMRI brain was also normal. So definitely you are dealing with NMDR encephalitis. This child had NMDR encephalitis antibodies positive. So EEG showed encephalopathic background. This type of cases, EEG will not help us. They will just show encephalopathic background, nothing else. So NMDR antibodies were positive. We do test this from NIMHANS all over, like even from AIIMS Delhi and PGI Chandigarh, we send our samples to NIMHANS only. And this is because of uniformity also, so we are very confident, okay, this is 3+ positive. This was child case of NMDR encephalitis. And whenever we find NMDR encephalitis, we also do PET CT to find out underlying malignancy. It was normal. So treatment, again case score which has come into the picture, because we treat from our first admission based on this score to guide our further treatment. Triple immunotherapy, because there was a severe presentation, methylprednisolone, IVIG and rituximab was given to this child. Lost to follow up for 1 month. They did not come for 1 month. Again came second admission, score was same, no improvement at all. Second dose of rituximab was given. At 2 months, third admission. So one thing you will be glad that all this treatment is free for these children from central government. This is AIIMS hospital. So even if it is not free, we will put them in some scheme and provide this treatment if it is necessary. Child has shown some improvement after third admission, mild improvement, but still child was lagging. You can see the score 21 was there. 4 drugs in last 4 months and there was no clinical improvement. We tried something which was not used routinely. We have not used it before this. We found this drug because other drug was tocilizumab, which could be used after all these drugs fail. But tocilizumab only acts on IL-6, and in our child, IL-6 was normal and disease has already taken a chronic course, and it is a cost-effective drug. Bortezomib we could buy for 500 rupees, 4 injections. Tocilizumab is something very costly, more than 10,000. So bortezomib be given for first cycle, child scores improved to 16. Second cycle of bortezomib after 3 weeks, there is clinical improvement was there. Child could sit, but still his score is 9. So we again given third cycle of bortezomib and child could walk. Currently child is absolutely fine in follow-up, doing all her daily activities. So learnings from this particular case was when conventional therapy fails, there are still options left. You have to keep searching, keep monitoring them. All these are treatable. You should believe them. Believe in yourself that they will be all right. So many times parents will doubt you that this child is not improving. You have to talk to them. If appropriate evidence is available, a trial of novel therapies should be given. Cost-benefit analysis should be done in when using such therapies. So this is the last case. This child came from all the way from Ludhiana, Punjab to us. Difficult. So child was showing to me in PGI Chandigarh. So that is why he has searched for me that where I am, and he came back to Jodhpur. So that is why I am presenting this. So Ludhiana, he was presenting to Chandigarh first, 3-year-old boy. Difficulty in walking and frequent falls since early infancy, not able to sit only with lot of effort at 3 years of age. So bizarre twisting postures were noted by parents, that is dystonia. History of diurnal variations was also there with inability to walk unassisted by the evening. So there was worsening happening over the evening. The child could barely move, barely sit, especially in evening. This was the condition of the child when he first presented to us at 3 years of age. Cognition was normal. He could, conversate with parents. Speech was not normal, but he can communicate through gestures. Tone was variable. Dystonia predominant was there in lower limbs more than upper limbs, and truncal dystonias were also there. Differentials, whenever we see chronic, so till now we have seen acute presentation. Now, because it is a chronic presentation, child is currently 7 years. So 4 years the last 3 years he is having symptoms from early infancy. So 3 years he is presented first at Chandigarh. IEM, mitochondrial disorder, so something genetic which is underlying metabolic disorder we kept as first possibility. Dystonia whenever is there, early onset, CSF neurotransmitter defects comes a possibility. And because there is a diurnal variation, dopamine pathway defects also comes a very good possibility, because especially dopamine pathway defects are treatable. So workup we done accordingly. most of the things are negative. MRI brain was already done outside, it was normal. We have also repeated, it is normal. So this is chronic progressive course, diurnal variations in the weakness with normal recognition. A possible primary dystonia was kept. This is the child currently. So he was having improvement, but still the parents complain of dystonia. Over the evening, he will have some worsening. So we have reviewed the literature. We did not stop at dystonia. We did genetics. It was positive for this dopamine responsive dystonia with with or without hyperphenylalaninemia. So we have added by reviewing these two drugs, salicylic and hydroxytryptophan, and child has shown remarkable improvement. This is, if anybody has visited to Jodhpur, must have seen this Mehrangarh Fort, mighty fort. So when they came last time to me in OPD, I told them to visit Mehrangarh Fort. So you can see that child who was not able to sit only, just by simple medication, dopamine, he could walk, climb Mehrangarh Fort, mighty Mehrangarh Fort. So learning from this phase is identifying the correct phenotype enables correct diagnosis. A right drug can turn immobility into ability, and treatment protocols may be modified when you get incomplete results. So this is my presentation. I will thank Prasho for giving me this opportunity. So already when I was hearing this initial introduction about Aashrai, I was very emotional. I'm an emotional person as per se. So it is very difficult to deliver this talk after hearing all this. So I am very emotional, and some is like I can call him my junior, as he has done his MBBS from 2007 when I has completed my MBBS. So something like that. I will thank Aashrai's parents that to give me this, to select me for this important award and bring me to such august gathering, and so many dignitaries are here in the audience. I have learned a lot by coming here. Thank you.
Okay.
Congratulations. Progress further and further, and let the little children, and let this little small children's so-called disabilities, or I don't know the right term for that.
Sarah, the mic. We could hear what you were saying anyway.
I'm just so glad that Dr. Lokesh Saini has done such a hard work, but at the same time very, very useful for the little kids. And they are mobile and they're improved. And it gives a great pleasure to the parents. And of course, I think I'm still, feeling so emotionally touched. And I hope and wish and bless that you would go further and further progress and help the little kids. Thank you so much.
Tarak, why are you sitting? I was thinking something is missing from that. Dr. Guru sir. Visible?
Yes.
This is a book which will give you some insights into Aashray. Thought we'll give it to you.
Keep it alive.
Yes, sir.
Thank you, sir. Thank you, everyone.
Dr. Lokesh Saini, I kindly request you to deliver the acceptance speech for the award.
So I am very grateful for the organization and very thankful to the family to start this awards in his name. To disseminate science, you can say this. So I was not a good student till school. I was a very average student. I was having 60% marks in 10th. You can understand reaching to AIMS, New Delhi, PGI Chandigarh is a dream for me. But I did all this after reaching Chennai. When I saw people, teachers teaching, so I got motivated. So they are teaching with so much passion. So I should learn from there. And this is an emotional moment for me too. I told that I'm an emotional person. And very grateful. Thank you.
We now have the address by our guest of honor, Dr. Hari Radhakrishna. We're very grateful to have you here with us, sir.
Good evening, ladies and gentlemen. I thank Pasho organization and also all the Murtigaru and others for having invited me as guest of honor. Thank you very much. I'm also very happy to see my classmate Dr. Jagannath here, Dr. Tar, very good friend of mine, and Dr. Vishwanath, who's coming from Karnool Medical College. So there's a great moment for me. And I'm also commendable this act of awarding, preparing an award for in the name of Mr. Aashrai is also one of the commendable thing. So I'm not a pediatric neurologist, but in the old time, as Dr. Tharak was telling you, those days there was hardly any research going on. So as age advances, I'm going more into prevention rather than treatment. So I'm also treating, but at the same time, I might like to concentrate more on the prevention. Particularly in the adult neurology aspect, I would like to say a few words with permission of Murthy Garu. So last year you have heard the talk on dementia. So dementia happens in the older age group, but the prevention actually, you realize that it starts right from younger age. Midlife, hypertension, depression, these have to be treated. And people, you are having hearing impairment should be properly provided with some hearing aids and stimulating the cognition. The brain has to be stimulated by puzzles, and people advocate learning new languages, music, new musical instruments, and people who drive, they go to the same destination but through different routes. All these things, they create more amount of cognitive stimulation. These things are more useful in dementia, preventing dementia, and controlling the hypertension, other things in the middle age, 30, 40 years only. That is very, very important. And of course, there is a diet. I think maybe those who are more worried about the diet aspect, yes, definitely there's two types of diets which are important in prevention dementia. Maybe you have heard last year, but again, it's maybe a recap. Mediterranean diet and DASH diet, these are the two important diets that are described in the literature. DASH is dietary approach to prevent, to stop hypertension, and Mediterranean diet is more of fruits and greens and other things to improve your antioxidant and also to inculcate more of vitamins. So this is about dementia prevention, but more commoner than that is the stroke. They say it is the third or fourth leading cause of death, and maybe the first cause of morbidity in humans. I see quite a lot of stroke patients in our hospital, and also maybe other neurologists also maybe seeing, not related to pediatric neurology, because pediatric also there are strokes, but they tend to recover quite a bit. And of course, you all know very well that treatment of hypertension, controlling diabetes, smoking. These are all things which I'm not going to highlight. They are important. But apart from that, two important things that I just would like to highlight at this juncture. One is obstructive sleep apnea. It is where the people does snore a lot. That produces respiratory obstruction, hypoxia to the brain, and that can lead to stroke. This is a very important aspect. People don't realize how they are in the sleep. Nobody knows, only the others will be knowing. So you must realize, and this is a very important thing. Another thing that I wanted to highlight is hyperhomocystinemia. There is a chemical called homocysteine which increases the blood that will accelerate the atherosclerotic process and thereby creating strokes. Atherosclerosis is the cause for the heart attacks and also for the brain. So similarly, and this is the commonly seen B12 deficiency, which is very, very common in patients, people more than 50, 60 years of age. And apart from that, coming to the pediatric age group, the epilepsies, the movement disorders, mostly they are genetic. I think proper genetic screening would definitely help in, you have seen the correspondence of dystonia, DYT5 gene. So these are genetic disorders which can be identified and treated immediately. Immediately after birth. Many of the hospitals, they do that, metabolic screening and genetic screening also they do. But apart from that, prevention of an attack of seizure, of an epileptic seizure, or a migraine headache, they go a long way in having a good life, for quality of life. These are by the adequate sleep, 7 to 8 hours of quality sleep, continuous sleep, and also avoiding, there's a term called glucose rush. Glucose, when you take more glucose, the child becomes more and more irritable and hyperactive, and that is when they also develop these seizures. So these are all things which go a long way in maintaining the health and quality of life in these individuals. So thank you very much, Murthy Garu and the Aashrai Foundation for having me here.
Thank you so much, sir. We now come to the address by our chief guest, Dr. Guru N. Reddy, founder and chairperson of Continental Hospitals, Hyderabad. Welcome, sir.
Try this. To the beautiful parents of Dr. Aashrai, distinguished fellow colleagues, ladies and gentlemen in the family. Truly, this is an emotionally charged evening. This will be one of the most memorable evenings of my career. This spans for almost, 42 years. An evening that was replete with love, with emotion, with empathy, with recollections, with such wonderful memories, with praise, and a wonderful life that was just cut short by the jaws of death, who could have been so iconic in terms of his contribution to the field of neurosciences and beyond. And such is life sometimes. Such is life sometimes. When Mr. Govind Hari, the chairman of Prasha, called me a few days ago, Guru, I want you to be the chief guest of this evening. I said, why are you calling me the chief guest? I know this story about 2 years ago when this nasty news came to my attention through the uncle of Aashrai, Dr. Jagannath, who's sitting here. He said, Guru, do you know anyone at the US Consulate General's office? I said, yes, Jagannath, I know the Consul General. She's a good friend of mine, Jennifer Larson. And so why are you asking me? Then I said, this has happened. The Murthys have to go to the US, or his brother, I presume, something like that. And could they get a quick emergency visa? Those were the times 2 years ago when we all know that visas were not being given, taking a year, 18 months, 24 months. But Jennifer was kind enough then to understand this. Before that, at a social evening, she met Dr. Jagannath at my home. And within less than 24 hours, I think she made that happen, and the family could join them. Through that evening and the next few days, when Dr. Jagannath explained to me as to what has happened, I said, how could this happen? A neurologist, a man who's contributed so much, and a distinguished physician, have to encounter a disease that's very much what in his domain. Perhaps he studied, he researched all his career. And as his friends and colleagues were just describing this evening, how much they looked up to him in terms of understanding complexities of various diseases and how he was helpful, and the very same person succumbing to it. And these kind of things truly happen. They happen every day, perhaps. And my journey, when they were talking about Aashrai, I didn't know anything about him beyond that. You know, when I was being called this evening, I was just kind of thinking, it's a very hectic day, what should I be saying? I know Dr. Murthy very well, of his contributions at the Public Health Foundation, absolutely a gentleman to the core, always have loved, visiting with him and speaking to him. So given this kind of scenario, I said, what should I be saying? Because I don't know Dr. Aashrai, I don't know about the person who's being honored this evening, other than reading his CV was incredible. I said, here is another young genius. India is such a wonderful country because after spending 40 plus years in America, a greater part of my journey was a reflection of those early days of what Aashrai went through. We graduate from this medical school, we toil, we struggle, we try to be our best. And we work harder 10 times than the native population in the US, and everybody knows that. And to reach that stage for us to present at so many conferences, your original work or posters or whatever that may be, and to be recognized by his teacher, his professor, and then being admired by your colleagues, irrespective of where you hail from, is not an easy journey. I'm sure many of you sitting here had similar journeys in life. But in a foreign country like America, Indians we have an extraordinary struggle. Dr. Vijay is here, my colleague who was there for equal number of years. We have to prove and work many times harder. And for him at such an young age, the drive that he had, not just in completing neurology, pursuing the other disciplines of neurology, continue to be a student at the same time being a clinician, is something incredible. Such examples will not be many. When they're talking about the NIH Fellowship of Neuroinfectious Diseases, or when you're talking about his interests in epidemiology, to follow in the footsteps of his illustrious father. So many of these things, at the end of the day, are not that easy, absolutely not that easy. There are many people in the history of the world, have died young. I wonder, throughout Vedantic philosophy or whatever philosophy we embrace in life, why that happens. This was Dr. Naveen Kumar at All India Institute of Medical Sciences just last year. He was 36 years old. Some of the great guys, if you know Henry Grant, the anatomy book that was written, Henry Gray, the Gray's Anatomy, which is our Bible. Without knowing Gray's Anatomy, we cannot really have the next step in medical school. He died at the age of 34. So was Horace Wells, who discovered the nitric oxide, changed the face of anesthesia in this world. So there were academic icons, Srinivas Ramanujan, examples from this country, cultural artists, Madhubala, Gita Bali. So many, you take these examples, and Mozart, and, Princess D, and, like this, when you see, and these are all great contributors in their own right. They were prodigies. And Aashrai is one of those geniuses and a prodigy. A prodigy in the making, but something happens to them that their life is just snared, just like that. And, plunging us into that great darkness. But I salute the parents, absolutely, for rising up so well, paying this tribute, recognizing his ideals, his work, and honoring, to continue to see that his legacy would be seen, or his legacy is preserved, and his work will be seen through the eyes of all those future great doctors and scientists, which perhaps of his 80 billion neurons of Aashrais is just scattered across the world. At the end of the day, that perhaps it's seeded every place, that so many of these research scientists is going to, do such wonderful work to posthumously, reward him, perhaps what he would have done. So thank you, JVS, ma'am, and for giving this opportunity, Govind Hari, and my fellow colleagues. Let us remember one thing in life. Live in the present. Things happen. Things happen. It can happen to any one of us, any of our children, any of our neighbors. But we have to really kind of understand the moment, kind of pull ourselves together like this, have a great exchange, and see how we can not only help to prevent by advancing medical science to that extent where every disease in this world can be conquered and humanity can be better preserved. As Hippocrates said in conclusion, when you love medicine, you love humanity. And that is exactly happening tonight. Thank you all very much. Appreciate it.
Thank you so much, sir. It's really wonderful at the end of the day before Dr. Rangareddy comes in. You talked about the millions of neurons being distributed across the globe. Just wanted to share that all the organs that were possible to be used, Aashray was donated on behalf of Aashray by his wife.
Thank you. What an emotional evening. Distinguished chief guest, colleagues. Today, I stand before you with a responsibility to give the vote of the thanks. I would have loved to say a few things about Aashray, but I think it is not the occasion. Probably I will use another occasion to share a few of those precious moments which we had together. So, as we come close to this roller coaster emotional event where we have remembered our dear Aashray, I would like to first of all thank the family, Dr. GVS family, for a thoughtful gesture of making Aashray immemorial. I think today's gathering is not just ceremonial. It is much more than that. To my mind, it is a moment of reflection, remembrance, and also the inspiration for the generations of doctors, especially the neurologists who are going to follow the path which could not be finished by Dr. Aashray. Through the heartfelt tributes and also the messages what we have heard from his fellow colleagues, family members, and also the friends, we know that Aashray is not only a physician, neurologist, but also a guy who had a lot of fun and loved actually living his life to the fullest. The remarkable life and legacy of Dr. Aashrai Gudlavalleti, we talked about him as a clinician. Probably some of them have talked about him as a mentor. But more than anything else, from whatever we heard today from three of his friends and colleagues that at the core, he is a very compassionate person. Definitely, he has left a profound impact on all those people who had the privilege of knowing him. Today, the memorial oration delivered by Dr. Saini was befitting and definitely inspiring. It is indeed a matter of pride that this year's award honors a professional of that high stature and also distinction and also the commitment. The words which were spoken by Dr. Saini clearly reflects not only the knowledge but also that compassion, passion and commitment for the profession which he has chosen. On behalf of the family, because I feel myself as part of the family, on behalf of the family and also the partial organizing team, I would like to first of all thank Dr. Guru and Reddy for accepting to be the special guest and the chief guest for this occasion. As I think, he doesn't need much of introduction. Everybody knows him. Dr. Reddy is widely recognized as an inspirational clinician and a visionary healthcare leader. Over the years, he had also been a very close friend of Prashu, where he has supported all our activities. I don't think there is one activity where we have invited or we have sought his help and he was not there. There are, I think, very few leaders who can match the clarity of vision and lucid insights he brings to every interaction. And today probably is not an exception. So thank you, Dr. Guru, for that wisdom and also your presence today on this occasion. Our sincere gratitude also goes to Dr. Radhakrishnan, who has kindly accepted to be here and delivered a very valuable address. And his work on dementia, I'm sure it is going to make a difference and also will be a tribute to the work what Dr. Aashrai has done during his lifetime. Our heartfelt gratitude goes to Dr. Taraknath. Of course, we don't need to say many things. He is also a family, so I don't think it would be befitting to say too many things of gratitude to him, but still, because it is the occasion where we have to thank all those people who made this possible, I would like to extend our gratitude for his leadership and making the right decision, choosing the right person, befitting for this particular award. We are also deeply grateful to Dr. Deborah, who has taken her very precious time and delivered the inaugural address. Not only she has taken her time, but also she has collected the memories from the team and ensured that all those reflections are embedded into her inaugural address. That is something which is really great. My thanks also to the colleagues and the friends who shared their personal reminiscences of Dr. Aashrai, bringing alive the warmth, humility, and dedication that define our dear kid, Dr. Aashrai. I would also like to acknowledge the presence of Dr. Govind Hari. We call him Dr. Govind Hari. Like Dr. Guru and me, I think, we have something in common on that front. we keep calling him Dr. Govindhari. I think he is more than a doctor. He is a social doctor. And, thank you very much for that presence and also giving the leadership to Prashu. I would like to thank our big boss, Dr. GVS, for making this event possible in many ways. That is one. Second is also presenting the introduction, because setting the tone is important. I think giving that broader picture is important. I think, he has done a beautiful job in giving that introduction to the award, the objectives of the award, and also, how the whole of this award functioning would be in the future too. I think, thank you very much, Dr. UES. I would also like to thank my sister, my colleague, and a very eminent microbiologist, Dr. Vishalakshi, for presenting the check on behalf of family and also Prashu. Finally, I would like to thank all of you for your wonderful presence today to celebrate the legacy of a remarkable doctor, an extraordinary human being. I think by coming together, we reaffirm that the values of Dr. Aashrai stood for excellence in medicine, humility in service, and compassion for humanity. All those things probably would continue to guide us and inspire all of us, whether we are in medicine or in other sectors. I am sure that is going to be a big inspiration. May his legacy continue to inspire generations of clinicians to practice medicine, not only with skill, but with humanity. With that, I once again thank you all for making your time to come over and celebrate, as Dr. Guru said, this prodigy and the genius who is no more with us, but he will be our guiding light in many ways. In the last, I would like to again congratulate Dr. Saini. I am sure now you have a big weight on your shoulders to take forward the journey and make the neurology even a better profession and also a better shoulder for the communities and the society at large. Thank you all.
Now, I would like to invite Govindhari sir, Chairman of Prasho, for his last words.
I think the organizers forgot to call me for the welcome address. So anyway, after vote of thanks, it is not customary to speak, but thank you very much, Guru. I told him that you must come. I rob your 3 hours today. Thank you very much. My great feelings for Vishala. Such a wonderful mother. Boldly, she took it up with Dr. GVS. And I remember before 30-40 days and after 30-40 days, what all happened. But I would like to enthuse the august audience here with a different note. Though I am a student of Vedanta and Shastra and Agamas and all, I am also a great follower and a fan of Osho, the Rajneesh. Death is a celebration. It is such a beautiful thing for the one who leaves, but we have to follow the one who leaves, because all of us are going to follow him one day or the other. So I was talking to my vice chair, Dr. Rangareddy, that the third award function, with the permission of Dr. GVS and Vishala, it should be on a different note of celebration. We must have this program of awarding, selecting, and doing all that, but we must have something differently curated. It should be a sort of celebration for his departure, for a better world, and also a celebration for all of us. We must have some musical program, a very good dance program, or a very good choreoed, orchestrated, and curated program, which will also bring in the required celebration for both the worlds, astral world and what we are here. I'm sure Dr. GVS will agree with me. And once again, I thank GVS and Vishala. Moment they got the insurance, first thing Vishala called me and she said she would donate everything to this cause. And she has also donated a big amount to Prasho Foundation for carrying on so many things. That was the largest, biggest donation we got. I come from a profession of professional beggars. Every day I do that for my institute and also for my temples and TTD and all that. The most responsible issue, donor gives and leaves, but the donee has to keep up to the expectations of the donor. It is such a big responsibility. It is such a big hard work to continue to do that year after year, to keep alive the donor's thought process and the way in which they donated to the cause. I was a bit hesitant to take that big money the day she offered, but there was no other choice. We took the money, and I'm sure we are performing and behaving responsibly for what you have donated, ma'am. Thank you very much. And I'm sure that we continue to do this year after year. And we have other 2-3 awards also which are parallelly going on. And I'm sure the selection criteria is fabulous. Last time also it was very good. And this time it's all Saini, a great guy, I tell you. And I see those children. It is such a great thing to see such things happening. And I once again thank all my friends, colleagues, and Dr. GVS and his family, and of course the other guy who is sitting in America. I thank all of you, and I request you to join for dinner and leave a very happy note for the day. Thank you.
So before we join each other for dinner, we have a group photograph. So it's all being organized near the reception area towards the entrance of the same floor. So I request everyone to head there before we join each other for dinner. Thank you.